This multivitamin product is used to treat or prevent vitamin deficiency due to poor diet, certain illnesses, or during pregnancy. Vitamins are important building blocks of the body and help keep you in good health. It is important to take this medication as directed by your doctor. The recommended daily dosage may vary depending on your age, gender, and medical condition. It is best to take this medication with food to help increase absorption. Always consult with your healthcare provider to determine the best time to take this medication for your specific needs. When taking TM Daily Vite 400 mg tablet multivitamins, it is important to follow the directions provided. Typically, this medication is taken by mouth once daily, or as directed by a healthcare professional. It is crucial to adhere to the recommended dosage and not exceed it. Taking this medication regularly at the same time each day will help you to get the most benefit from it. If you have any questions about the dosage or timing, do not hesitate to consult your doctor or pharmacist. Some common side effects of TM Daily Vite 400 mg tablet multivitamins include constipation, diarrhea, or upset stomach. These effects are usually temporary and may disappear as your body adjusts to the medication. If any of these effects persist or worsen, it's important to consult your doctor or pharmacist promptly. If your doctor has prescribed this medication, it's because they have determined that the benefits outweigh the potential risks of side effects. Many people using this medication do not experience serious side effects. Although very rare, a serious allergic reaction to this drug may occur. Seek immediate medical attention if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects. If you experience any other effects not mentioned here, it's essential to contact your doctor or pharmacist. In the US, you can call your doctor for medical advice about side effects, or report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects, or report side effects to Health Canada at 1-866-234-2345. It's important to keep TM Daily Vite 400 mg tablet multivitamins containing iron out of reach of children, as accidental overdose of iron-containing products is a leading cause of fatal poisoning in children younger than 6 years. If overdose does occur, it's crucial to seek medical help immediately or call a poison control center. Before taking TM Daily Vite 400 mg tablet multivitamins, it's important to let your doctor or pharmacist know if you are allergic to any of its ingredients, soy, or peanuts. This product may contain inactive ingredients that can cause allergic reactions or other problems. It's also important to discuss your medical history, especially if you have a history of alcohol abuse, liver problems, or stomach/intestinal issues. If the multivitamin contains folic acid, be sure to inform your doctor if you have a vitamin B12 deficiency before taking it, as folic acid may affect certain lab tests for vitamin B12 deficiency without treating the anemia. Before undergoing surgery, it's important to inform your doctor about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant or breastfeeding, be sure to consult your doctor before using this medication. It's important to take the daily dosage as recommended and to consult your doctor or pharmacist for more details. Drug interactions can affect how your medications work and may increase the risk of serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. This includes prescription and non-prescription drugs, as well as herbal products. Never change the dosage of any medicines without your doctor's approval. If your multivitamin contains iron, be cautious about taking it at the same time as antacids, bisphosphonates, levodopa, thyroid medications, or certain antibiotics. Consult your doctor or pharmacist to find a dosing schedule that works with all your medications. If your multivitamin contains folic acid, let your doctor or pharmacist know if you are taking anti-seizure drugs, as it may interact with them. This medication may also interfere with certain lab tests, leading to false results. Be sure to inform lab personnel and all your doctors that you are using this drug. If you or someone you know has taken too much TM Daily Vite 400 mg tablet multivitamins and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the US, you can call 911 or contact your local poison control center at 1-800-222-1222. Canadian residents can reach out to a provincial poison control center. Symptoms of an overdose may include stomach pain, nausea, vomiting, and diarrhea. It's crucial to act quickly in these situations to get the necessary help. Make sure to keep all your medical and lab appointments. There are some brands of TM Daily Vite 400 mg tablet multivitamins that may also contain ingredients like docusate. If you have any questions about the ingredients in your specific brand, be sure to ask your doctor or pharmacist. It's important to note that TM Daily Vite 400 mg tablet multivitamins is not a replacement for a healthy diet. It's always best to get your vitamins from nutritious foods. Make sure to maintain a well-balanced diet and follow any dietary guidelines given to you by your doctor. If you miss a dose of TM Daily Vite 400 mg tablet multivitamins, take it as soon as you remember. If it is close to the time for your next dose, skip the missed dose and take your next dose at the regular time. Do not take a double dose to make up for the missed one. It's important to store TM Daily Vite 400 mg tablet multivitamins at room temperature, away from light and moisture. Avoid keeping it in the bathroom, and make sure to keep all medications out of reach of children and pets. When it comes to disposing of this product, it's crucial not to flush it down the toilet or pour it into a drain unless instructed to do so. Make sure to properly discard the product when it's expired or no longer needed, and consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.